Hi everyone, I'm a doctor, and today we're going to talk about a symptom that understandably causes a lot of anxiety: chest pain. That sudden twinge, pressure, or ache in your chest can be terrifying, and your mind might immediately jump to the worst-case scenario, like a heart attack. But I want to start by reassuring you that while chest pain should always be taken seriously, it doesn't always mean there's a problem with your heart. There are many potential causes, and my goal today is to help you understand them better. We'll break down what's a true emergency, what other common causes might be at play, and why you should never ignore it. First and foremost, let's talk about the red flags. These are the signs that mean you need to stop what you're doing and get emergency medical help immediately. If your chest pain feels like a heavy pressure, squeezing, or fullness, and this feeling spreads to your left arm, right arm, or both, or travels up to your neck, jaw, or back, that is a major warning sign. If this pain is accompanied by other symptoms like breaking out in a cold sweat, feeling nauseous or actually vomiting, or experiencing sudden shortness of breath, this is a critical situation. Don't try to drive yourself to the hospital. Don't wait to see if it gets better. Call your local emergency services right away. Paramedics can start life-saving treatment on the way to the hospital, and in these situations, every single second counts. So please, remember these symptoms and act fast if you or someone around you experiences them. Now, let's discuss some specific heart-related conditions that can cause chest pain, aside from a heart attack. One example is pericarditis. This is an inflammation of the pericardium, the thin, sac-like membrane that surrounds your heart. The pain from pericarditis is often described as sharp and stabbing. A key feature is that it tends to get worse when you breathe in deeply or when you lie down flat, and it might feel a bit better when you lean forward. Another heart-related issue is angina. This isn't a heart attack itself, but it's a warning sign. Angina is chest pain that happens when your heart muscle isn't getting enough oxygen-rich blood. It often occurs during physical exertion or emotional stress and usually goes away with rest. It might feel like pressure or squeezing, similar to a heart attack, which is why it's so important to get it checked out. These conditions highlight that even among heart-related causes, the experience of chest pain can vary significantly. Beyond the heart, your digestive system is a very common source of pain that can be mistaken for a heart problem. Have you ever had a burning sensation rising up from your stomach into your chest after a big, spicy meal? That's likely acid reflux, or GERD, which stands for gastroesophageal reflux disease. This happens when stomach acid flows back up into your esophagus, the tube connecting your throat and stomach. This can cause significant chest discomfort, often described as heartburn. Another digestive issue is gastritis, which is inflammation of the stomach lining. This can cause a gnawing or burning ache in your upper abdomen that can sometimes feel like it's in your chest. Often, digestive-related chest pain is linked to eating and might be relieved by antacids, but it's not always easy to tell the difference on your own. Your lungs, which share the chest cavity with your heart, can also be a source of pain. Conditions like pneumonia, which is an infection in the lungs, can cause a sharp or stabbing chest pain. A classic sign of lung-related pain is that it gets noticeably worse when you take a deep breath or cough. Another serious lung condition is a pulmonary embolism, which is a blood clot that has traveled to the lungs. This can cause sudden, sharp chest pain and severe shortness of breath, and it's a medical emergency. Even something like pleurisy, which is inflammation of the lining around the lungs, can cause sharp chest pain with breathing. So, if your pain is tied to your breathing patterns, it might be pointing towards a lung issue rather than a heart problem. Finally, let's talk about the musculoskeletal system: your muscles, bones, and cartilage. It's entirely possible to strain a muscle in your chest wall, maybe from a heavy workout, a bout of intense coughing, or even just lifting something awkwardly. This type of pain is usually localized to a specific spot. A key giveaway is that the pain can be reproduced or made worse when you press on that area, or when you twist your body or move your arms in a certain way. You can also injure a rib or have inflammation in the cartilage that connects your ribs to your breastbone, a condition called costochondritis. This also causes localized, tender pain. While musculoskeletal pain is generally less dangerous than heart or lung issues, it can still be quite painful and concerning if you don't know what it is. Now, I want to clear up a few common myths and facts about chest pain. Myth number 1. All chest pain means you're having a heart attack. As we've just discussed, This is a huge myth. We've covered digestive issues, lung problems, musculoskeletal strain, and even anxiety can cause physical symptoms like chest pain. So, the fact is, while a heart attack is a possibility, there's a very wide range of potential causes. Myth number 2. Heart-related chest pain is always a sharp, sudden, and intense pain right in the center of your chest. This is a dangerous misconception often perpetuated by movies. The fact is, heart attack symptoms can be much more subtle. For many people, it's more of a feeling of pressure, fullness, or squeezing, not necessarily a sharp pain. And as we mentioned, the discomfort can be primarily in the jaw, neck, back, or arms, with little to no actual pain in the chest itself. Women, in particular, may experience these more atypical symptoms. Myth number 3. If the pain goes away, it can't be serious. This is absolutely false. Let's go back to angina. This is chest pain from a temporarily blocked blood supply to the heart. It typically comes on with exertion and goes away with rest. The fact that the pain is temporary doesn't make it less serious. It is a critical warning sign that you have underlying heart disease that needs to be addressed to prevent a future, full-blown heart attack. Never assume that pain that resolves on its own is insignificant. So, we've covered a lot today. We've talked about emergency symptoms, heart-related causes, digestive and lung issues, musculoskeletal pain, and we've busted some common myths. If there is one single message I want you to take away from this video, it is this: do not self-diagnose your chest pain. It's great to be informed, and I hope this video has helped you understand the possibilities, but your internet search or your best guess can't replace a proper medical evaluation. The symptoms can be confusing, and the stakes are simply too high. If you are experiencing new, unexplained, or concerning chest pain, please make an appointment to see a healthcare professional. Let us help you figure out what's going on. It might be something simple, which will give you peace of mind. Or it might be something serious, where getting an early diagnosis could save your life. Your health is your most valuable asset, so please take care of it. Thanks for watching, and I'll see you in the next video.